Okay, 0 to 3 months. The first thing that I always make sure kids can do when they're born is they should have full range of motion on their neck. So when an infant's born, they actually have about 110 degrees of cervical rotation, which means when you turn their head to the right, you should have no resistance at all until you get past their shoulder. That's normal range of motion in an infant. Same with when you go to left, you should be able to go past their shoulder, no restriction at all. Like it should just be super easy to move them all the way to the left, all the way to the right. That's normal range of motion. If they do not have that, it can be a couple different things. It can be that during the normal natural birthing process, about 80% of kids have misalignments in the upper portion of their neck. That can play into it a ton. So if they're not seeing a chiropractor and that is the case, they can't turn their head fully, make sure they see a pediatric chiropractor that knows how to adjust kids and especially infants, super low force. It's about the amount of pressure that it takes that you can put on your eyeball. That's what it takes to adjust an infant. It doesn't take much force at all, but it helps get that better alignment, which helps with their cervical range of motion. That's number one. Number two, that we are born with a reflex called an asymmetrical tonic neck reflex. And you see this developing in kids or infants when you lay them on their back and they have their head turned to one side. What happens is they straighten everything on the right side of their body and they flex everything on the left side of their body. Same thing on the opposite side. You turn their head this way, they flex everything here, they straighten everything here. What that does is when their head turns, you're activating all these muscles in their neck. They reflexively extend everything on the same side of their body, which helps teach them how to open up their body, how to extend their arm, extend their leg. And on the opposite side, you see flexion, or they flex everything on this side, flex everything on this side. And that teaches them how to flex that side of their body, number one, but it also helps them to start developing hand-eye coordination and knowing where their body is in space. But if a good example of this is you can use this reflex to get that normal, natural range of motion back if it's not developed in kids. So let's say, for example, you turn their head to the left and they have super good range of motion. They can go all the way past their shoulder, no restriction, but they can't turn their head to the right. This happened to my own son. After he was born, he couldn't turn his head to the right and he couldn't tilt his head to the right. But that's because, number one, he had some misalignments in the upper portion of his neck, and also this reflex wasn't being activated efficiently, so we helped him to redevelop it. It's super simple. All you have to do is straighten his leg on that. So if he can't turn his head to the right, you straighten his leg on the right, you straighten his arm on the right, and if you have a third person, you can even have them flex everything on the left side of their body for them, but you'll naturally kind of see that happen anyways. And then you turn their head to the right, and once you meet resistance, you go back to the middle. Then you can turn your head to the right and you'll get a little bit farther, go back to the middle. Turn the head to the right, go back to the middle, turn the head to the right, go back to the middle. And as you do that repetitively over and over and over again, their neck will get looser and looser and looser. But it's just simply because you're using a natural reflex that we're born with to help get that range of motion. I have parents do that about 10 times a day. So they turn their head till it gets nice and loose, and they come back to it, an hour later and check it again. Is it tight? If it is, then you do that range of motion exercise until it gets loose. If it's loose, you don't need to do anything, because that means they're using those muscles. Over a few day period, they'll get that range of motion back. So you see this a lot in kids that have torticollis, but we wanna make sure, number one is, can they rotate their head all the way? Because that range of motion needs to be there for them to activate those muscles, turn their head, and start developing their cervical musculature, which again plays into the development of the rest of their body. This is a big deficit that I see in infants, especially when they're born. Even ones that are, quote unquote, healthy and they have no problems, this is a problem that needs to be looked at. Other reflexes that are present when your child is born that we need to make sure are present. There's one on your hand. It's called a palmar grasp reflex. What should happen when you stick your finger in their hand or you stroke the palm of their hand is their hand should reflexively grasp down. That should be there until about 3 or 4 months of life, then it should go away. So it's how you get the reflex to be there is really simple. If it's not there, you stroke, 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 and eventually what you'll see is after you do that I usually have parents do it like for about 2 minutes, a few times a day. What you'll see over about a week or two period, and maybe even quicker, a lot of times it's within a day or two, is you'll start to see them grasping down, and then you're gonna keep stroking it and keep having them grasp, 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 because again, they need to activate those muscles to connect that to their brain. That palmar grasp reflex, if it doesn't develop appropriately, or go away at appropriate time frame, which we'll talk about in a little bit, you end up seeing fine motor difficulties and even speech delays, because it relates back to development of what's called your lateral cerebellum, which plays a lot into speech, and also fine motor skills. Another one is what's called your rooting reflex. If you breastfeed, you'll see this. When you stick your nipple to their face or you stroke their face like this, what you will see is they will reflexively turn their head and start to open their mouth and start to suck. That reflex helps them develop the musculature of their mouth, plays a lot into speech development later in life. And so it needs to be there on both sides. You should see it on the right and the same as on their left. And then another one that should be developed when they're born is when you stroke the bottom of their foot. So if this is the bottom of my foot and this is the outside of it, this is the inside of it, when you stroke on the outside, what you should see is their toes coming up like that. It's called the Babinski reflex. It should be there till about a year of life. Making sure that that is there is really important because it plays a lot into total brain maturity. And then after a year, it should go away. If it doesn't go away after a year, a lot of times you'll have toe walking issues or different things like that. So making sure that that is there when they're born is super important. And then another one, there's one called a spinal galant reflex, which helps you to develop your core musculature and especially the muscles that help you to extend and also help you to roll. Let's say this is their spine. I'm gonna use my Mickey here, right in the middle. What you're gonna do is you're gonna stroke up or down right next to the side of their spine. And what you'll see when you stroke is they'll curve, their whole body will curve towards that side. You stroke, their whole body will curve towards that side. And you may have to stroke, you can stroke kind of all the way out. So you'll stroke, 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 stroke. And what you'll see is they should curve, curve, curve as you stroke. Same with on the opposite side. If you're not seeing that, again, you elicit it, or stroke, 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 stroke multiple times a day for a couple minutes until you start seeing them respond or react to that. Then you're gonna do it repetitively just to get those muscles to activate and get them nice and strong. Kind of think of it as you're kind of giving the kid a workout and you're activating their core musculature, which is needed for them to lift their head when they're laying on their tummy, which is also needed for them to start developing rolling as well. And lastly, another reflex that I always make sure they're born with is we want them to have what's called a moro or a startle reflex. So when you drop them quickly, and make sure you support their heads so they don't get, they don't whiplash their head, but if you drop quickly like that, what should happen is their arms should come out like that. They'll probably start to cry, and then they'll basically come out like that, and then they'll go back to normal, and they'll come out like that, and they'll go back to normal. Or if you make a loud noise around them, again, same thing, startle, their arms come out, and then they'll come back in. But that is a reflex. It is super important for the development of our sympathetic or fight or flight nervous system. And then also it should go away right around 3 to 4 months as our parasympathetic or rest and digest nervous system starts to develop. So number one, in the first 3 months, we need to make sure all of those reflexes are there. If they're not, you simply elicit them. So again, if I'm not having a reflex, you stroke, stroke, stroke until you start seeing it. Bottom of my feet, if you don't see them, you stroke, stroke, stroke until you start seeing it. On my back, stroke, stroke until you start seeing it. And then same with rooting reflexes and the startle reflex. If you're not seeing their arms come out, again, you do it over and over and over again until you start seeing their arms coming out, arms coming out, arms coming out, because those are really important to start the development. A lot of our sensory systems, our ability to feel our own body, know where it is in space, which is really important for, you need to know where your body is so you can develop rolling. You need to know where your body is so you can develop crawling on time. So sensory reflexes really need to be there in that those first 3 months of life. And then they should go away. Thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that and that'll get you to the right spot. Have an awesome day.